So how does a prospective patient go to the next step?
Well, I think patients need to first investigate whether or not they think this is right for them, because obviously surgery isn't right for everybody. And there may be a time in your life when you're just not ready. And so that's the purpose of our team, is to help people along. If they're not ready, get them ready. Not to say you're not ready and go away, but to say, how can we help you get to the point, and how can we help? Sometimes the biggest help we can do is not to do surgery on someone, and we're able to control things and get things in a position proper. You know, that's really the purpose of a team approach.
Well, our team also is going to look at all the different things that are going to help somebody get ready, but also make them prepared after surgery. But before surgery, we're looking at the standard health maintenance things. Are the pap smears and mammograms and prostate tests up to date? Are the heart tests up to date, and so forth? And those are things that everybody should be doing whether they have the surgery or not. And they usually do to get ready for the surgery, and we think that's a better thing. But also, by doing that, we've found some medical problems in patients that may not have been found early enough, and so we've helped a lot of patients just by doing that.
Exactly.
Well, as far as the results in the surgery, what about weight loss?
Well, weight loss, at least weight loss, as you said, is not the most important thing here. The important thing is improving the health condition. And but weight loss, on the average, for a bypass is, we toss out numbers like 60 to 70% excessive weight loss over a long period of time. What does that really mean? It just means that you're smaller and you're healthier. Yep. And so.
And a quick generalization then is, if you're 100 pounds overweight with the bypass, you're going to lose about 70 pounds. With the band, probably around 50 pounds. But you can do better with the band or better with the bypass, depending on how you use that tool.
Right. We have a lot of patients that get to be their ideal body weight, which is pretty hard to do.
Now we are a team, but we also have a team, and that includes the office. That includes our nutritionist and registered dietitian, our psychology, and so forth, as well as the primary docs and the referring docs, as well as the specialists that help us get a lot of those different tests. But what about the hospital?
Well, I think the hospital is pivotal. I mean, obviously the surgery occurs in the hospital, and as a surgeon, we're used to dealing with tools and technologies and things like that. And of course, we want the very best. We want the most up-to-date, the highest resolution, the best equipment possible, and that's what the Fresno Heart and Surgical Hospital gives us. But the hospital isn't just a building. The hospital is built up of nurses, dietitians, it's more than just the building. It's also everyone surrounded. And so for us to do our job, we have to be surrounded by people that do their job and do it very well. And I think we have really quite good staff there, don't you?
I think we have some of the best staff in the world, and I think we have some of the best technology in the world. The Heart Hospital has brought all of that together, and so it's a combination of surgeons, it's a combination of the best nurses and supporting help, as well as the best technology in the world. And the Heart Hospital has brought that together as a team, and I think that team approach is really what's made this a special program.